So today we're going to drain a seroma. This is a patient about 48 hours after facelift, and she developed a right side puffy, spongy, fluid-filled seroma, and I'm using a 14 gauge angiocath IV catheter with 10 cc syringe and putting the needle in and aspirating the seroma, and it's just blood breakdown products. Now I'm going to slide the catheter over the cannula, and that will start draining just by gravity, as you see. And the seroma can be very irritating, and if you leave it there, it can fibrose and cause permanent washboard type deformity, or one that can take many, many months to heal. So you want to drain these as soon as you see them. I'm just milking it out. And what we're going to do is we're going to tape this into place, and we're going to leave it in for a couple days. Usually the tape will hold it in for several days, and we want to do this until it stops draining. So if you don't recognize these and they form and they organize, they can be very problematic. And sometimes you have to drain these 5 or 6 times, but putting the angiocath in is helpful. Then I use a little bit of Kenalog, 10 milligrams per ml, and I just inject that around the pocket of the drained seroma for its anti-inflammatory benefits. Because again, the seroma can be extremely irritating. And finally, again, we use a cling dressing with gauze to hold this in place. And the patient's going to have to change this because they can continue to drain. And so we give the patient extra gauze and extra cling, and that's how we treat the seroma.